great books. But now we have his knowledge as he goes across lecturing, educating people to be advocates for their own health throughout the United States, Canada, Australia, New Zealand, all focusing on preventative and nutritional medicine. So, Dr. Strand, I would love to say hello to you this evening.
Well, thank you. Thank you for that introduction. And I believe I can share my screen. Is that correct?
I believe so.
I'll just see if I can do it here. And then let me share this and get the, do the slideshow here from the beginning. And, I want to, I'm going to approach Slenderiiz more from my perspective as a physician.
Yes.
Now, most people come into my office, my medical practice, they're concerned about losing weight, but I, as a physician, am more concerned about their health. And I hope by the time we finish, I've answered most of the questions just in the presentation that you sent me, Crystal. I appreciate that. It allows me to kind of know what people are thinking and see where we are. But anyway, we're going to talk about the Slenderiiz, Partner Co Slenderiiz program, but more from my position. And I want to just start out by saying, people are concerned about losing weight. 2/3 of the adults in the US and 1/3 of our children are either overweight or obese. Now, it doesn't take too much. Anybody walks around, tries to get on a plane and have someone sitting next to them that's maybe a little overweight, they know there's a problem out there. And this is why 30% of Americans are trying to lose weight at any one time, and another third basically are trying to maintain their weight. Now, here's an interesting thing. Americans are spending over $30 billion a year on diets and weight control plans. But here's what's really discouraging. When you look at the medical literature, if you can lose weight, I don't care what diet you look at and do, 2/3 of those people who lost weight on a diet gain it back within a year. But if you go out 2 years, 98% gain their weight back and more. So, diets fail 98% of the time. I've seen it, everybody says, oh, I've tried this, I've tried that, this go up, it goes down, but I think you have to sit back and ask yourself, why don't diets work? Well, the main reason diets don't work is they're a short-term solution for a long-term problem. Now, what do I mean by that? I mean, patients that come to me and say, oh, Dr. Strand, I'm going to go on such and such a diet or this diet or that diet. It doesn't matter. Well, the connotation is if my patient's going to be going on a diet, somewhere in the future, they're going to be coming off that diet and normally or usually returning to those poor lifestyles that got them into trouble to begin with. But the main reason diets fail is because they do not address the core issue of why over 80–90% of these individuals are gaining so much weight, which is insulin resistance. In other words, you're just not as sensitive to your own insulin as you once were. So this is a modern epidemic. We initially called it Syndrome X, then the metabolic syndrome, then insulin resistance syndrome. Now we're calling it prediabetes. But 25% of all the adults in the US and Canada have prediabetes. Another 25% of all adults are in the early stage of prediabetes. That makes over 100 million American adults that are affected in total. But about 1/3 of our children are in this. And that's why the CDC now projects that any child born today, over 1/3 of them are going to develop diabetes sometime in their lifetime. And if they happen to be Black, Hispanic, Native American, that's 50% are going to develop diabetes. Now, think of the consequences of diabetes in a medical practice. Well, it's a leading cause of amputation, of neuropathy, of blindness, of kidney failure. That's why they end up on dialysis, and it goes on and on and on. But what I'm going to share with you today and tonight is the fact that 90% of type 2 diabetes, that's the old adult onset diabetes, can and should be prevented if you just knew what to do. And this is where my song and dance has been. And so let's talk about prediabetes, or what was called the metabolic syndrome. Well, Dr. Gerald Ravens, a researcher in Stanford, a medical physician but researcher, back in the 1980s, started to notice a constellation of problems that were part of what we call insulin resistance. People that were developing prediabetes or this metabolic syndrome had an unusual weight around the middle. Well, this was associated with high blood pressure, the good cholesterol going down, and the very bad LDL cholesterol going up. The other fat in the blood, triglycerides, start to go up. Blood sugars start to go up, and you're at significant increased risk of both heart disease, stroke, and diabetes. And that's why this central weight gain, many physicians are referring to now as killer fat. It's a central weight gain. And this is just part of this whole picture that we now label as prediabetes. And so you have to understand this when you're starting to approach weight loss, because most of the people in the world that have this central weight gain and struggle with problems, now we know that we're starting to see that obstructive sleep apnea is related to this, and polycystic ovarian disease is related to this. And so we're starting to add more and more things to this insulin resistance syndrome. So let me back up here and just talk about nutrition, just in a short segment here. But in 1901, there was a theory regarding how fast we absorb sugars from our meal. And it was simple sugar versus complex carbohydrates. And I want you to notice this theory was presented in 1901. And yet today, almost all of the nutritionists, not nutritionists, but mainly our dietitians, still believe this. And in other words, it was, all carbohydrates are just long chains of sugar. And the longer the chain of sugar, the complex carbohydrates, it would take the body longer time to break it down and raise your blood sugar. Where the simple sugars like glucose, which is 2 molecules, would break down and raise your blood sugar very fast. And so that was challenged by a Dr. David Jenkins at the University of Toronto in 1981. And he just challenged this conventional wisdom and actually put this theory to test. And how he did it is he took subjects and actually fed them a particular carbohydrate, and he measured actually how fast that blood sugar increased after that. And he developed the concept of glycemic index and glycemic load. And so just to give you an illustration, he compared everything to glucose. That's what it becomes in your bloodstream and in your body. And so he gave straight glucose to an individual and just measured how high it went up. And this is the rise. Well, then he gave this a glycemic index of 100. Well, then he would take a study food, in this case, sweet cherries, and he would feed the same amount of carbohydrate, sweet cherries, to his patient and measure the rise. And in this case, he made glucose 100, and then the sweet cherries rose the blood sugar 22% as high as the glucose. So he gave it a glycemic index of 22. That's when you hear, that's how we found, we did white bread, flour, rice, cereal, grapes, pears. So here's a simple just illustration of just some representative foods. Here we have glucose at the top, and what we have, let me just get my marker here, just so you can see. Up here, glucose has a glycemic index of 100. Well, look at the baked potato. A glycemic index of 85. Mashed potatoes is actually 91. All cereals are in the 80s, cornflakes, any cereal you pick. Look at bread. This is white bread, is 71. This is actually a multi-grain bread is 70. But now look at the simple sugar. Table sugar had a glycemic index of 61. Look at the peach, sweet cherries in the 20s, 28, 22, black beans, 20. So here we look at bread, flour, rice, cereal, baked potato, actually spike your blood sugar faster than if you're slapping or spooning table sugar on your tongue. Well, we know how bad sugar is, but these foods are much worse. So if you look at glycemic index, most researchers believe a low glycemic index is below 50 or 55. In the medium range is 50 to 70. High range is greater than 70. And, you know, we are not going to talk about glycemic load at this point. It's just the amount of calories in a certain food. And you got to understand, you know, certain foods may have a high glycemic index like watermelon, but it doesn't have any calories. So you can eat that and your glycemic load is around 5. Anything less than 10 is very low. Carrots is 47, but you look at the glycemic load is only 4. Well, you can't eat carrots fast enough to spike your blood sugar. So I, in my book, explain you need to look at both glycemic index and glycemic load. Now, what's the problem of spiking your blood sugar? That's, you know, we know that the 1901 theory was concerned about it, and that's why they put sugars and sweets at the top of the food pyramid. But when you wake up in the morning, you have a fasting blood sugar represented by this dashed black line. You go and have a meal, and 80% of our meals are high glycemic. This is average. And I know this crowd, much better eaters than that, but let me just explain. But if you have instant oatmeal or you have, you know, a donut or a bagel, the blood sugar is going to go up very, very fast. Well, the body must control blood sugar in a very narrow range. So this rapidly rising blood sugar stimulates the release of insulin. Now, insulin its job is to take that glucose in the bloodstream, drive it into the cell to be utilized as energy or stored as glycogen or fat. That's its duty. But when you spike that insulin, well, then the blood sugar goes down just about as fast as it went up. But here's the key. It usually drops below, in the majority of people, below the fasting blood sugar into the low blood sugar range, or what we call hypoglycemic range. Now, if this blood sugar is allowed to keep going down, 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 what you're going to find, you get a shaky weakness, you get mental confusion, you can literally have a seizure and go into a coma. And diabetics know this if they're using insulin or some drugs. So the body must correct that. And so this low blood sugar stimulates release of our stress hormones like cortisol, adrenaline, and glucagon, and drives that blood sugar back up to normal. But what we find is even though the blood sugar comes up to normal, now you have these high stress hormones going around in your bloodstream. Well, this creates just a carbohydrate craving or an addiction. You got to have some more. And you usually crave another high glycemic meal, and you keep doing this over and over and over again. And it leads to, we call it hyperphagia, but you just overeat, but you can't help yourself. It's a natural physiologic response to spiking your blood sugar. So what you've been calling emotional eating and cravings all these years, in the overwhelming majority of time, is just the natural response, physiologic response to spiking your blood sugar. It's a hormonal change. And this is what leads to our cravings and all that. Well, if you just see this, we keep doing this day in and day out, over and over. Eventually, you just don't respond to insulin like you used to. You become less sensitive to your own insulin, and that leads to insulin resistance. So when we come to eating, this is one aspect. It has a lot of complications, but I like to explain this because most people that are involved and want to look at Slenderiiz are wondering why in the world do they gain so much weight and why can't they get it off? Well, when you tip over into this abnormal metabolic state, a calorie is no longer a calorie. Now, this goes against the mantra of the weight loss industry for the last 75 years. Calories in must be less than calories, or less than calories out, or you can't lose weight. It's all counting calories, doing this, and how much calories is. That's not the problem, because when you tip over into insulin resistance, you're in an abnormal metabolic state and you don't utilize calories normal. The muscle becomes insulin resistant first. And why is that important? Well, it's important because a muscle normally takes up at least 90% of all your calories from any food or snack and utilizes it as energy. But if the muscle can't take it up normally, now many of the calories that used to be used for energy are being diverted to the fat cells of the abdomen. And insulin's job is to actually convert that glucose and store it as fat, and then block the release of that fat. So when you get into this state, you hold on to fat like a sponge holds on to water. You just cannot lose weight, and you can't lose it effectively. If you can lose some weight, boom, put it right back on. This is the reason we have yo-yo dieters. I've heard this story over and over in my medical practice. I get a patient come in and say, "Gee, Dr. Strand, I never had a weight problem. Now I'm 29, and last year I put on 15 pounds, and this year I'm already up 20. What's going on? I haven't changed my diet. I haven't changed my activity. I'm doing everything the same." Well, you see, you don't just develop insulin resistance overnight. And the main reason is you look at, and I'll finish that story. When you look at the USDA food pyramid, now that you've recognized what I've told you, what is at the top of the food pyramid? It's fats, it's oils, but it's sweets, it's sugar. Okay, stay away from sugar. But what's at the base of the food pyramid? Bread, cereal, rice, pasta. These are worse than sugar. So if you follow this great USDA food pyramid, and the medical community's advice, it is actually the cause of the diabetes, obesity epidemic. They're telling you the wrong thing. This is the way the food pyramid should look. These foods are worse than sugar. Whole foods, vegetables. We find out that our main enemies are processed grains and the almighty white potato. And so anytime man processes grains, it sets it up so the body can absorb the sugars from those grains much better. If you take whole oats and you soak them overnight and cook them in the morning, that is a low glycemic meal. If you take slow cooked, oatmeal, that's just flattened. It's not processed, but it's just the whole oats is just flattened. Then it's a medium glycemic index. But if you have instant oatmeal, it's high glycemic. If you take an apple, it's better than than apple juice, or applesauce. And the applesauce is better than apple juice, and the apple juice is better than the diluted apple juice. So the more man processes food, the more it sets it up that we can absorb it. So here is the key. This is a graph that was brought in by one of my drug reps years ago, a pharmaceutical rep. And he was trying to sell me a drug, or the recommended drug to prescribe my patients. It was called Avandia. Well, Avandia improves insulin sensitivity. So this graph is 25 years in distance as far as age. And you can see what I was saying is people don't become insulin resistant right away, but the poor lifestyles, usually it's inactivity and the all-American diet, eventually over time you become more resistant to your own insulin. That's represented here by the orange line. So insulin resistance goes up. Well, how does the body deal with that? The body compensates for this by actually increasing insulin production. So insulin production goes up. And like I told you, so your insulin levels are high when you develop this. But as long as these two lines parallel, your blood sugars remain normal. So what we find is that we as physicians over the years have pretty much just focused on blood sugars. We don't recognize the problems with insulin resistance. But once you tip over into this abnormal metabolic state, your arteries begin aging a third faster than they should. So every third year, just add a fourth year of aging to your arteries. And what happens is our body can't continue to make this insulin. And so it begins to finally fade as the green line goes down, insulin production goes down, there goes your blood sugar up. And we as physicians diagnose this blood sugar or diabetes about in this area. Well, here these people have been insulin resistant with accelerated aging of their arteries for 12, 15 years before they become diabetic. Well, this is why the day I diagnose someone with diabetes in my medical practice, over 60% already have major cardiovascular disease and coronary artery disease. It's too late. And this is what I've been preaching for the last 25 years. We need to be diagnosing prediabetes back here where it's easy to reverse. Not that we can't help the diabetics, but this is what we're talking about. So Partner Co's Slenderiiz program is really a first step therapy, not a diet. Now, let me explain first step therapy. As a physician, the medical community, medical society always recommends that physicians give their patients a trial of healthy lifestyles in many medical conditions as the first step to therapy. So early high blood pressure, early diabetes, early high cholesterol, and the list goes on. They believe, hey, let's give them a trial of healthy lifestyles. Now, most physicians ignore that, and they just can't wait to write you a prescription because we're disease-oriented and we're drug-oriented. But you have to look that Partner Co's Slenderiiz program was developed with this science that I've just shared with you as an understanding. So I look at it as a 4-part comprehensive healthy lifestyle program, not a diet. Why would we want another diet? They fail 98% of the time. So Partner Co developed the Slenderiiz Accelerate program. So let me explain this. It's 4 parts. It's Slenderiiz Accelerate, a healthy diet, one that does not spike your blood sugar, modest exercise, not being a superstar, and nutritional supplementation. At least I recommend the Nutrify Optimals. You can also add or use Tahitian noni juice, MOA, Rejuvenex, may also be added, and anything, but you need at least the cellular nutrition that I've explained. So let me just go over this. I recommend Pure Nourish as a key for success in my medical practice. It's actually a behavioral modification tool. Now, we spent a long time developing this. We put 2 scoops in water or almond milk, coconut milk, along with some frozen fruit. I put in Giving Greens every morning with mine. I also put in some beets and I have some kale. But it allows you to easily experience a healthy diet that does not spike your blood sugar because it's low glycemic. But it's soy-free, dairy-free, gluten-free, GMO-free, has probiotics, prebiotics. I mean, it's a wonderful meal and or snack replacement. But it's something you've got to realize is really a nice thing. And this is part of your food budget. And in our clinical trials that I have done 3 clinical trials using this program, all showing wonderful success in improving the metabolic health of my patients. I used to have them, or I did in the clinical trial, have them have 2 meal replacements, learn how to eat 1 regular low glycemic meal and 2 low glycemic snacks. So that's a key. So we talked about the high glycemic diet, but now I want to show you this graph again. If you look at the turquoise line, sure, you start out with fasting blood sugar, but if you don't spike your blood sugar, which is a low glycemic meal or having a Pure Nourish meal replacement, it doesn't go up that high. Yes, you'll stimulate insulin, but you don't overstimulate it. And it'll eventually go back down to the fasting blood sugar. You're going to get hungry again. Hey, fine, just eat another low glycemic meal. And this shows, just doing 1 meal, the medical literature shows your blood insulin levels begin to drop. You have a second one, it goes down lower. So just eating this way significantly improves insulin sensitivity from a particular mechanism. Well, then we look at exercise. Now, you don't have to be a superstar. In fact, I believe in modest aerobic activity. This improves insulin sensitivity, again, from a different mechanism. But I like my patients to build up to doing something 30 minutes, 5 days a week. It could be brisk walking, biking, hiking, swimming, tennis, anything that gets the body moving, okay? And you don't have to be a superstar. And we don't want to do it every day. That's why I say 5 days a week. We need to rest. We need to rest the body. And so aerobic activity is key to improving insulin sensitivity. Now, is weight resistant training good? Hey, fine. It builds more muscle that you utilize glucose. But the key, it must be added to a basic aerobic activity. This is key. Now, you look at Slenderiiz and Accelerate, and I've got a lot of questions. People want to know how we got this. I was involved initially as we brought this in. It's a homeopathic drug. Now, let me explain homeopathics. Homeopathic takes an ingredient that they have known for hundreds of years. And what they do is they dilute it, and they dilute it more, and they dilute it more, and they dilute it more. And so they find the more they dilute these ingredients, the more potent they are. So that allows us to make a very safe homeopathic combination. And there are 10 different ingredients. So if you're taking medication, you're worried about estrogen stimulation or this, or taking drugs that if you have breast cancer that are lowering it, this is not a problem. You can take any medication with this. There's no counterindication. So of the 10 different ingredients, about 6 of them improve insulin sensitivity and help release fat. Another 2 suppress your appetite, and another 2 increase your metabolism. So it works in a lot of different ways. But anybody that's taken Slenderiiz knows, hey, my appetite's gone down. Well, you start eating, like I told you, a low glycemic meal, you know, after you get out of that carbohydrate cravings and addiction, it usually takes 5 to 15 to 20 days, depending on how bad it is for you, your appetite goes down. Now, here's one caveat. The medical literature shows if you're doing well and you spike your blood sugar just one time, you set off this uncontrollable hunger for the next 2 to 3 days. That's why cheating is not a good idea. And that's why we want to be very faithful and understand it, because you can set this stuff off, especially in the sensitive people like me. Now, Accelerate has been added to Slenderiiz and Slenderiiz, and it contains high doses of vitamin B12 for increased energy, but it also increases metabolism along with a biotin. It also contains 2 Ayurvedic herbs, ashwagandha and rhodiola. And the reason that's important is it's stressful to make lifestyle changes. It's hard. There's a little stress to it. This is a calmer. This calms down. And no matter where you stand, I know one of the questions I want to answer right now, what if I'm on an SSRI, you know, an antidepressant drug, which we know the side effect is weight gain. It's horrible. That's one of the things. You're not going to have as fast of a response just because of the medication, but I have my patients improve even taking SSRIs, and there's no conflict. So that's it. Now, let me explain. Other people ask, well, can I do the diet and exercise and supplements without taking it? Well, sure. I did this program that I've developed and did the clinical trials. I started in 1996, and I didn't have Slenderiiz or Accelerate, and I did fine by the healthy lifestyles. And so, you know, I didn't show nutritionals, but you know, we know that vitamin E, vitamin C, vitamin D, grapeseed extract, magnesium, chromium, all of these improve insulin sensitivity. All these studies show that. And that improves insulin sensitivity from another mechanism. So if I could get my patients to make one of these lifestyle changes, whether it's diet or exercise or nutritional supplementation, I saw some improvement. If I could get them to do 2 of the 3, I saw a little bit more improvement. But if I could get them to do all 3, diet, exercise, and supplementation, the results were simply phenomenal. And the reason is this is not an easy thing to improve. And so all 3 of those improve insulin sensitivity. And that's all I did is when I took a very simple philosophy, since it's poor lifestyles that gets us into this problem, maybe healthy lifestyles that improve insulin sensitivity could take us out of it. And that's what the medical literature showed. And when you combine them, we have success. When I started adding Slenderiiz and Accelerate, my improvement happened twice as fast, which is not bad. Everybody likes fast, and so when I use this, instead of taking 12 weeks, it takes 6 weeks, to do all the improvements I saw in those medical trials. And so that's where this fits. Now, it's key. It's not magic. I mean, I've been in medicine a long time. I mean, we started out with amphetamines, as weight loss, pills in the 60s and 70s. And then we've got fen-phen, and we got this, and we got that. Now we got other ones that are out there that everybody's all excited about, but they're drugs. And the trouble is you can't stay on them forever. They all have bad side effects. We know how people got addicted to the amphetamines and what tragedy that is. We know fen-phen, a third of the people used it got heart valve damage, a third. And we don't know what Ozempic's going to do. It's not good, or similar medications, but I've been there. But I still look at Slenderiiz and Accelerate as an aid. It's got to be combined with a healthy diet, a healthy exercise program, and nutritional supplementation as part of a lifestyle. Don't forget that. Because if you're going to treat this, I'm going to get weight off, and you go off everything, you're just going to gain the weight back. I mean, and that's more dangerous than just maintaining your weight. So what are the health benefits then of the Slenderiiz program? And this is where we have to go. We get a healthier blood pressure, a healthier lipid profile. I've seen triglycerides come down, the good cholesterol goes up, cholesterols get better. Healthier blood sugars go down, they improve. In my diabetics that start this, they're further down the line, but they all see improvement. It just takes them a little longer. But here's the key: they establish their healthy weight. They begin releasing fat as the blood insulin levels start to drop. And they just go on, and it's first step therapy is the opportunity to firmly establish healthy lifestyles that allows an individual to be less dependent on medication, or hopefully even be able to avoid it altogether. And so when you look at this, I want to go back to this graph. All people that have early insulin resistance, and that's the ones we did the clinical trial, in 90 days, we saw blood insulin levels drop 50% in all 3 clinical trials. These were under the guideline of the FDA. The last one was published, and it's called an IRB. So they were done. I was hands off, but it was using this program that we now see in front of us, minus the Slenderiiz and Accelerate. So if blood insulin levels dropped 50%, what people were doing were tipping back to the normal state. Blood insulin levels dropped 50% and got back to normal. So what happens? It's just the reverse, excuse me, from building up. So blood pressure gets better. Your triglycerides improve. You start losing weight around your middle. And my patients come in and says, "Jeepers, Dr. Strand, what's so hard about this program? I feel great. I have more energy. I'm not going hungry. I have more energy, and I'm starting to lose weight, and I'm not trying." Well, why aren't they trying? Because we're not relying on willpower. This is very important. You can't gut it out. You can't do this. You're going to fail. But if you start to eat right, things just naturally begin to happen. And all this is to help you accomplish, this improving. Now, if you're diabetic and you're sitting out here, I tell my diabetics, type 2 now, not type 1, because they have no insulin. So we're just really talking about 90% of the diabetics, which are type 2. And yeah, they have high insulin levels, but it takes them 18 to 24 months of doing this program to get optimal improvement. So they're not going to see the quick improvement. And so if you had 10, 20 pounds to lose, that's going to happen pretty fast. If you've got 60 to 80 pounds, it takes a little longer. So everybody needs to understand that. Now, I just want to show you this, because being in this kind of medicine, and I'm not pushing drugs and all that. In 2008, The American College of Endocrinology and Association of Clinical Endocrinologists, these are the diabetes specialists in the world, got together to form a consensus opinion, and they were looking at prediabetes. And what they found in this, they concluded, they looked at the worldwide medical literature like I did writing my books, and they saw the preferred treatment approach for all the abnormalities of prediabetes is intensive lifestyle management, given its safety and the strength of evidence for its effectiveness, improving glycemia and reducing cardiovascular risk factors. Now that's a big, and they basically came out and said, we need to be treating prediabetes as aggressively as we do diabetes, because by the time we as physicians start treating diabetes, it's essentially too late. It's too late. That's why 80% of our diabetics are dying still prematurely of cardiovascular event like a heart attack, a stroke, ruptured aneurysm. We have amputation, kidney failure, all of this stuff. It's horrible. And we need to be going earlier. And so they're finally coming out. But what are they recommending? They're recommending lifestyle modification should be the cornerstone of treatment. It should be attempted with all patients and reinforced in every visit with a healthcare professional. Lifestyle is a fundamental management approach that can effectively prevent or delay progression from prediabetes to diabetes. In our clinical trials, we feel 90% of prediabetes should be prevented and can be improved by these lifestyle changes I've shared with you. This is the Slenderiiz program that Partner Co is sharing with you. It's not just losing weight. So Partner Co Slenderiiz program is not a diet, but instead a healthy lifestyle. Now, weight loss is great. However, keeping it off is priceless. You know, what excites me most as a physician is when my patients come and say, well, Dr. Strand, I've been on your program and I lost all my weight and I've kept it off now for 6 years. That excites me because they have done it. In fact, I have done my own little clinical trial and study in my own practice over these many 40 years plus. And what happened is I would get someone on a diet program. And there are 2% that lose the weight and keep it off. 90% fail, but 2%. So when I got a patient in that said, gee, I was on this diet and I've kept it off for 6 years, I asked them one question. It says, did you change your lifestyles? And, oh, absolutely. That response I got 100% of the time in the people who are successful. So it's not magic, but it's there, and it's a very important program, and you've got a lot of support. In my medical practice, I found it's good to have accountability. I like people, and I've shared this with Dr. Vance, to write down everything they eat, how they exercise, how they're taking their supplements, and how they're taking their drops, what they're drinking, and put it down. Because you then are taking, subconscious lifestyle habits and you're making them conscious. Now, I never asked for perfection in my medical practice. I just wanted honesty. And that's all it took. I educated them, but I had to hold them accountable. If I didn't, I was successful about 10 to 15% of the time. But when I had them write everything down and they were accountable to somebody, I got up over 80% success rate. And that was, that was it. Now, here's my book. The problem is my wholesaler now has gone bankrupt and hard to get on Amazon, but it tells you everything here. We're going to be working on that, trying to get that back online, but it's a little harder to get a hold of. But I just wanted you to see this. I spent 3.5 years researching what I've just shared with you in this book. I got nearly 30 pages of references. And it's the JAMA, the New England Journal of Medicine, the British Lancet. I mean, these are mainstream journals that I have shared. It's all based on medical science. And that's why Partner Co is excited in allowing and putting this all together to help you not only lose weight, but to improve your health. And with that, I'm going to stop sharing and then let Dr. Vance kind of ask me some questions that I didn't quite cover.
Well, Dr. Strand, I don't sure there's anything you didn't cover right there. everyone is in the chat just saying how incredible this is and how much they've learned this evening. And my biggest thing that we see in the circle of health is, and you did touch on this, the thought process of thinking that eating healthy is a diet.
Well, it's a lifestyle. And if you're eating healthy and you're going to do it every day, it just becomes a part of living. And that's what happens. You change your eating habits. And the key thing that people miss, and this is my patients, they come in, and when I say in phase 1, you got to not have any bread, potatoes, flour, pasta, rice, cereals. They can go into a cold shake. And in my book, I actually call it a carbohydrate addiction, because it's a endocrine, everybody says it's hormonal. Well, it is. You spike, you go through that and you set off these stress hormones. And one simple study, they took 12-year-old boys and they either gave them a low glycemic breakfast or a high glycemic breakfast, 2 groups. Then they said, kids, eat whatever you want the rest of the day. The kids that had the low glycemic meal ate 80% fewer calories than the high glycemic kids. They reversed the kids, saw the same thing. It wasn't the kids, it wasn't the breakdown. It was just spiking their blood sugar and setting off this uncontrollable hunger. So when people start eating correctly, that goes away. The cravings go away. Now, hey, we all crave something and do it, but there's ways to cheat and at the end of a meal, and fruit desserts are fine. I mean, once we get to our health and weight goals, I go to phase 2, and I'm sure, and they want to maintain it, but that's the healthy lifestyle.
Definitely. One question, where is your, a lot of times we've got people coming in with all of their diet nutrition. They're all the way, all polar opposite from their diet sodas and their diet foods to stevia, monk fruit. Like, where do you stand in the thought process of utilizing the sweeteners?
Anything that says diet, aspartame and all this are horrible. And and you can get hooked on them. We've learned more and more. I mean, all of them. I don't care which one you bring up. They all are bad. And they can cause migraine headaches. They can cause, a lot of times we don't think about it. They can be problems. I mean, it goes on and on. But the thing is, it's addictive. Have you ever seen a person drinking a Diet Coke that isn't overweight? Now, there may be out there, but they're not many. So I'm saying if Diet Cokes worked, well, shoot, as much as they consume, they should be skinny. They're not. It doesn't work. Sugar, sugar is not, and we all like something sweet, but the natural fruit, when you quit eating all that stuff, fruit tastes more sweet. I mean, sweeter. You have, things are better. It just becomes natural, and people don't understand it. I've had people get out of this and the syndrome, excuse me, I'm drinking water, who get out of this and they do really well. That's in my throat. Go ahead if you got say.
Yes. So one of the things that we have here with Partner Co, as I spoke to a few minutes ago, Dr. Strand is part of our scientific advisory board. Now that scientific advisory board, as well as a wellness council, is different health providers, whether it's chiropractors, medical doctors, dentists, naturopaths, homeopaths, and Dr. Strand leads that. But there's something that makes us very unique, and that is the seal of excellence, the seal of approval that comes from Partner Co. Would you be able to speak to that, what that means to you? And, as our chief, as you stand here, what does that mean to you?
Well, as a physician, I'm used to writing prescriptions, and that. If you write a brand name prescription, let's say it's 100 milligrams, it must be within 1% of that 100 milligrams has to have that quality to be considered a brand name product. Generic products, believe it or not, is 30% one side or the other. So it has to be from 70 milligrams to 130. Well, when the hardest thing for me when I went from traditional medicine into being a nutritional medicine, preventive medicine, is the fact that it's an unregulated market. In other words, I found out the FDA looks at supplements like they look at foods. They could care less what the manufacturing is. What there's no guidelines. Even today, there's not. I mean, they may talk about it and stuff like this, but there aren't. So anybody can make any. So I'd say 70% of nutritional supplements out there, it's cost. That's all I worry about. I'm going to sell the calcium cheaper, this cheaper. We don't care what it is, whether it's absorbed, not in the bottle, whether it's pure, could care less. Well, another 15%, 20, at least go for food grade, good manufacturing practices. Well, to get that label, they need about a third of what they say is in the label in the capsule or tablet. And it's junk. So when I got in there, I realized, gee, I see the medical literature. I know people improve when the quality's there. I want my patients to get what we're saying. And I don't want people to sell their health to the lowest bidder. So that's why I checked out Partner Co. well before I became involved. And the thing is, I looked at the manufacturing practices, not their manufacturing FDA registered facility, not required, but these companies step up like Partner Co. and we're going to do it in spite of the fact we don't have to. They get pharmaceutical grade raw products, manufacture much like they do drugs. In fact, Partner Co.'s manufacturing facility also is approved for making over-the-counter drugs. Well, there's no better manufacturing, and therefore they can give 100% guarantee of the purity and the quality because of the manufacturing. Now, there are many companies that say that, but here's the difference. They don't turn their products over to a third party to actually verify that what they're saying is true. There's only a handful, and Partner Co. leads the group. And what they do is they've gone to NSF and they go to Consumer Lab. They don't just check up, sporadic like in the optimals. They check every one, that not only that it's there, but they can do blood levels. Well, that's what gives me confidence to be part of this. The homeopathic drops, people want to know, this was developed by a homeopathic physician. They do different things than we do, but it's pure. It's a drug. It's got to be pure. And the thing is, it's different in certain markets. We can't get homeopathic drugs in there. Therefore, we have the day and night drops as a substitute. And those are nutritionals that offer similar benefits of increasing metabolism, increasing insulin sensitivity, and calming and getting sleep. So that market, so we had to develop the day and night drops. But where you have the homeopathic drops, that's what it is. It's drug and it's pure and it's safe. I showed the dilution and everybody that's out there. So we don't have to worry. Pregnant women can take it. They can do this. Here's the thing. A lot of women don't. I did OB for 21 years. A lot of people don't know this, but I get these women in. And what are we doing about mid gestation or in the middle of their pregnancy? We're checking to see if they're diabetic. Remember, we don't want, so we're doing it. And many of my patients weren't diabetic. The blood sugar was normal, but now I realized they were putting all this weight. They just looked at food and they gained weight. They just put it on and they couldn't believe. I mean, they gained 40 to 60 pounds and their blood sugars, they were insulin resistant. So if you do the diet and you do this and you're going to do so much better. And that's one of the signs we ask for prediabetes. Did you gain a lot of weight? Did you have big babies? All of that. So pregnancy can do it. And so children can do it. I get my children, this is so safe. All the children, I mean, I wouldn't do it under 6 or 7, but you start to get 8, 9, 10, some of those kids are big. And I take young people, especially in the early teens, just as they're going through puberty, because that decreases insulin sensitivity. So right now, I'm going to share this, Dr. Vance. When I went to medical school and I was in pediatric training, they said if you have a child under the age of 30, 98% of the time that's type 1 diabetes if they get diabetes. In other words, they didn't have insulin. You know what that is now? 80% of children are getting type 2 diabetes as young as 6 years old. Well, this program is needed for everybody, and you don't have to be a doctor to recommend it. I'm talking to everyday people because doctors are too busy in their medical practice to do this. They're too busy prescribing drugs, doing this, taking care of all the complications of diabetes and everything else. Where we're an army, we can go out and change the health of the world, and we can get weight off, and all these transformation stories you hear from people on the stage, they have changed, they've improved their insulin sensitivity, they've gotten at the heart of the problem. They're not facade, and they've lost weight effectively, and they're not gaining it back. So that's kind of that story.
Well, I think that might be a mic drop moment right there, Dr. Ray. I so appreciate you coming on here. And I mean, I see all these questions, but here's the thing. Start the drops. That is the best thing that you can do, is simply get started. Now, what about that person? This is the last thing I'm going to ask you. What about that person that gets started and in week 3, they haven't lost a pound? What do we say to those people?
Well, it takes time. It's taking you 10, 12 years to develop insulin resistance. It's not magic, and the thing that I have found is that, just like anything, yeah, the drops help, it decreases appetite, but if you're not eating the diet that's in the book, and if you look through it, it's all been labeled. It doesn't have bread, flour, rice, cereal. That improves insulin sensitivity. Then it's just like my diabetics. They'll come in and they're doing well before, and then they come back. I'm gaining weight back. My blood sugar's going on. I said, what did you drop? Well, I quit taking my nutritionals, or I quit exercising. They gave up something. I could see it every time. Well, when you start with just the drops, yes, it's good. And I know it, and economics plays into this, but you still can eat a healthy diet and exercise and pick up one of the antioxidants, improve insulin sensitivity from that. I don't care if it's MOA, noni, do all this. Now, I know people like you, we get into it and they're doing everything. Restorix helps. I've seen people plateau, they get on Restorix, and remember, there's a lot of heavy metals in the fat, and you're releasing it. It's nice to get rid of it. There's all kinds of tricks, but it's really time and doing everything. I'm a firm believer in everything, and the drops are the support. Now, a lot of people, because of I'll just start this. This is all I can afford. Fine. But it's nice to know there's places to go. And most people, Dr. Vance, they feel better and they're losing weight, but they want to go faster. Well, then you start adding stuff and they get excited, and it can go the other way too.
Yeah. Well, I just want to say thank you. Thank you for coming on here. Thank you for serving this community inside Circle of Health. We do have this recorded.